Hi folks, Dr. Ed Byer. Today we're continuing in our series of what causes female hormone imbalances. Typically by the time I see a female come to my clinic, they're suffering from, all types of different symptoms, PMS symptoms, cramping, pain, pelvic pain, migraine, headaches, short periods, long periods, acne, depression, anxiety, mood swings, weight gain, hair loss. When the female hormones are out of balance, it can cause just about any symptom imaginable. They go to their, traditional medicine and they get put on birth control pills or some sort of synthetic hormone contraceptive, which is very deceiving because it can help with the symptoms, but it leaves a whole cascade of other serious health issues in the female body. A woman is meant to ovulate, so by going on birth control you don't ovulate, and it really creates a lot of problems. Anyhow, I am into why hormones would be dysregulated, and today we're going to be talking about liver biotransformation and hormone balance in the menstruating female. Now, what I mean by biotransformation is the hormones, when we make them and then we use them and then they gotta go. Okay, and I'm speaking, that's true with males too, but in this video we're singling out female hormones. So you make your hormones, you use them, and then they gotta go. And no one ever talks about eliminating or clearing hormones. That initially gets done in the liver, and they get biotransformed, they get chemically changed through a whole complicated system of enzymes, and then they go to different places. This is really important. So if the liver isn't working very well, that is a very common source of an imbalance in female hormones. All right, so the liver takes these hormones, which are fat soluble, and it converts them to be water soluble, and then it sends it to the gallbladder, the kidneys, and then into the bloodstream. Sometimes they get eliminated through sweat and actually through breathing them out too. But it has to get biotransformed and changed in the liver first. If the liver is not working to its full capacity, and we're going to be covering why that might be, then these hormones only get partially transformed or partially metabolized. They get reabsorbed right back into the bloodstream, back into circulation, and they keep stimulating the receptor sites, and it'll create overstimulation, and eventually the receptor sites will start ignoring the hormone, and then you'll have symptoms of hormone deficiency. Remember, when hormones are too high, that's going to stimulate the receptor site too much, and the receptor site starts to ignore it. So it doesn't matter how many hormones you have, it matters how well they're binding to the receptor site on a cell. That's when it makes the change in the cell. So that's really important. Now, the liver isn't, also with the liver is the fat burning organ in the body, and so this is another reason why liver dysfunction can lead to weight gain or an inability to lose weight. Some of the symptoms of a poor liver or gallbladder function, like greasy, fatty foods, cause distress, lower bowel gas and bloating even hours after eating. Not right away after eating, but like later. If you take a fish oil supplement or you eat fish and you can burp it up or taste it, that is a sign that it's not working very well. A lot of skin-related issues, hair loss, also weight gain because of what I said. It's the fat-burning organ. Overall sense of bloating. A lot of times people say I'm puffy all the time. My face looks puffy. That's liver. Yellow cast to the eyes or dark circles under the eyes. History of gallbladder problems too. So some of the lab findings we'll see that we checked for, and from a functional perspective, is elevated cholesterol, triglycerides, LDL, and low HDL, elevated liver enzymes, SGOT, SGPT, or GGTP, and alkaline phosphatase, and low glutathione status and low glycine, which we checked on a particular test called an organic acids test. This is how we know whether your liver is working properly and it can clear these hormones. So some of the causes of liver dysfunction, taking too many hormones, like birth control pills, prescription drugs, alcohol, caffeine clogs the liver, smoking, sugar is very hard on the liver, car exhaust, any type of solvent exposure, contaminated lotions, air pollution, pesticides, in our meats or in our vegetables. So we really should be eating organically. Look, you could eliminate 50% of the toxic load in your body by doing one thing, and that one thing is eat organically. I know it costs more, but it's such a big thing. Well done meats, low vegetable diet, low glutathione, and also there's certain genetic mutations too that a lot of my young female patients have, they're never aware of, that slows down the liver's ability to clear hormones and toxins out of the body. So when we suspect these, we run these genetic tests, and we can work around it by giving them certain forms of vitamins and things to work around these genetic mutations. There's 6 of them right here that affect liver function. A real common one is the MTHFR and this COMT. And these are people too who won't have the effect of certain medications because they get metabolized too slowly or too quickly sometimes. So we have to look at these. Now, when we come across a female with hormone imbalances, with liver problems, we have to detox the liver. So we teach them how to avoid some of the toxins that they're being exposed to, and then we use different botanicals or different vitamins and enzymes to actually flush the liver clean. So I'm Dr. Byer. I hope that helps. Have a great day.